Driving by a care facility isn't enough to really know the environment. It just gives you a glimpse of it. Before you even step inside a care home, you need to think about the needs of your loved one and make a list of concerns and questions. There are no federal standard for small care homes. It is important to really research each residence. States that have licensing regulations will often provide surveys on each care home. So begin with contacting your state's Department of Aging for any information, or ask the residential home for their survey. Oftentimes, people will judge a residential facility by its looks. Although the ambiance may be nice, the most important thing should be the caregiver's background and experience. You should look for care facilities that treat their residents with dignity. If the caregivers are happy and smiling, then the residents will be happy. The facilities should be tidy and clean. This also goes for the look of the residents as well. Speak with the residents, take note of how they look, and also how the staff interacts with them. For example, it isn't a good sign if a staff member just barges into a resident's room just to show it to you, or if the residents are still in their pajamas at 3 in the afternoon. When you are touring, take a moment and ask yourself if your loved one would fit into that facility. Watch the residents during activity time and look at the activity calendar. Ask about the following. Smoking. Each state has different laws regarding residents and smoking. Health. How are the health issues managed, including daily living activities like bathing and toileting? Does the staff make doctor's appointments? Transportation. Is there transportation to medical appointments or other outside activities like church services? Meals. Will the home provide various meal options that will appeal to the taste of your loved one? Money. Can spending money be managed by the staff? Finances. How much is the monthly rate, including all the fees? Does the home accept Medicare or Medicaid? Are there out-of-pocket costs before they will accept Medicare or Medicaid? Exactly how does billing work? Do the residents pay using a long-term care insurance or by Medicare or Medicaid? Medications. Are the residents reminded to take their medication, or does the staff administer them? Will the prescriptions be filled and picked up by the staff? Security. If the residential home accepts dementia residents, make sure that the perimeter is secure and the doors have alarms. How will a caregiver know if a resident has attempted to exit the home? It is very important that you visit more than just one home before you make that final choice. Always schedule an appointment for your first visit and ask the house manager or owner all of your questions. After you have toured several properties and have narrowed your choices down, then visit unannounced at various times of day. Be respectful of those who are living there and don't show up early in the morning or late at night. Before you select a residential home, be sure that your questions have been answered. Remember, ask anything. These people are going to be your employees.